Hello, everyone, and welcome to a new session of antimicrobial, antibiotic, clinical pharmacology, drug therapy. Today, we are going to speak about flashcard. It's not like regular lecture. I am Dr. Khalid Hassan, a professor of clinical pharmacology and clinical research. Okay, first question for the flashcard. What is the definition of antimicrobial therapy? The definition include the use of agent that kill or inhibit the growth of microorganism. Could be bacteria, fungi, viruses, parasite, and the purpose of that to treat infection. What is selective toxicity in antimicrobial therapy? Targeting differences between microbial and human cells to eliminate pathogens without causing significant harm to the host. Define bactericidal drug. Drugs that actively kill the bacteria. Define bacteriostatic drugs. Drugs that inhibit growth of bacteria or replication of bacteria. Give example of bactericidal drugs. We have penicillin, cephalosporin, aminoglycoside, vancomycin, sulfonamide, tetracycline, chloramphenicol, erythromycin, and trimethoprim. Why are penicillins considered among the least toxic antimicrobial drugs? Because they interfere with the site unique to the growth of microorganism, the cell wall, which humans do not have. Why is chloramphenicol reserved for life-threatening infections? It is less microorganism specific and has high potential of serious toxicity to the patient. What is concentration dependent killing mean? Mean an increase in the rate of bacterial killing as concentration of antibiotic increases. Which drug classes exhibit concentration dependent killing? Two main examples, we have aminoglycoside, we have fluoroquinolones. We can add here, for example, daptomycin, fosfomycin, polymyxin. So we have a group of medication. Not only these two groups, aminoglycosides and fluoroquinolones. How are concentration-dependent killing typically administered for maximum effect? Once daily, high-dose bolus infusion to achieve high peak levels. What is time-dependent killing? Concentration independent. So time-dependent killing, another terminology, concentration independent. So the killing rate does not significantly increase with the higher concentration. Effectiveness depends on the time of the drug remain above the certain level. This depends on the time, such as beta-lactam, penicillin, cephalosporin, glycopeptidides, macrolide, and clindamycin. What is inherent resistance? Mean when an organism is naturally resistant to the antibiotic. Example, gram-negative organisms are inherently resist vancomycin. What is acquired resistance? Acquired resistance means when the microbial species normally responds to a drug, developed resistant strains. Give the reason to use combination of antimicrobial drugs. When we have like possibility of emergence of resistance, a treatment of critically ill patient with undefined infections to achieve synergistic effect. What an example of a drug combination used to prevent resistance? A treatment of tuberculosis. We use more than one medication, such as isoniazid, ethambutol, streptomycin, and so on. What an example of synergistic antimicrobial combination? Cotrimoxazole, which is trimethoprim and sulfamethoxazole, used for pneumocystis carinii pneumonia. Name three clinical scenario for prophylactic use of antimicrobial. We have four here. We have history of rheumatic heart disease, dental procedure for patients with prosthetic devices, individuals who are in close contact with patients with tuberculosis or meningitis, prior surgery procedure to decrease incidence of infection after surgery. Why zidofudine used prophylactically in pregnant women with HIV? Zidofudine considered like antivirus medication used for HIV. Why you use this medication in pregnant women? Okay, the purpose of using zidofudine to prevent the transmission of HIV to the fetus. What is the common serious complication of penicillins? Here we ask about serious complication. Hypersensitivity reaction ranging from urticaria to anaphylactic shock. What is specific direct toxicity associated with high level of aminoglycosides? We have ototoxicity. We can add here also nephrotoxicity. So direct toxicity from the aminoglycoside, ototoxicity, nephrotoxicity. Define superinfection. Superinfection mean overgrowth of opportunistic organism like fungi or resistance bacteria due to the alteration of normal flora by broad-spectrum antibiotic. What is a clinical sign of superinfection after broad-spectrum therapy? White GERD like vaginal discharge, yeast infection, or intense itching. Which antibiotic are considered safe during pregnancy? Safe during pregnancy, we have penicillin, amoxicillin, and ampicillin, cephalosporins such as cefalixin, ceftriaxone, macrolides such as erythromycin and azithromycin. What is the mechanism of action of metronidazole? DNA inhibition through a full mechanism is often described as unclear. So metronidazole inhibit DNA, bacterial DNA, or microbial DNA. What are common side effects of metronidazole? Metronidazole may cause nausea, dry mouth, and metallic tastes. What is disulfiram-like effect associated with the metronidazole? Nausea and vomiting that occur if alcohol ingested during metronidazole therapy. Metronidazole primarily active against which type of organism? Anaerobic, gram-positive or negative anaerobic bacteria, certain protozoa like Giardias and Trichomonas. How does rifampin affect metabolism of other drugs? Rifampin induces cytochrome enzyme 1A2, 2C9, 2C19, 2D6, 3A4. This will lead to the increasing elimination of drugs like methadone, anticoagulant, and contraceptives. What is the first step in selecting an antimicrobial agents? We need to identify the infecting organism through clinical judgment and laboratory testing. What are empiric therapies? Empiric therapies mean treatment started immediately based on the most likely pathogens before laboratory results are available. What is definitive therapy? Definitive therapy means choosing a specific antibiotic based on the result of culture and sensitivity testing. What does the site of infection? How does the site of infection influence the drug choice? The drug must be able to reach to the site of infection. For example, we need this antibiotic to cross blood-brain barrier for someone suffering from meningitis. Name a patient factor that influence drug selection. Renal or hepatic function, age, pregnancy status, or immune system integrity. What does minimum inhibitory concentration mean? The lowest concentration of antibiotic that prevent visible growth of microorganism. I will repeat it. The lowest concentration of antibiotic that prevent visible growth of microorganism. MI MIC, minimum inhibitory concentration, the lowest concentration of antibiotic that inhibit visible growth of microorganism. What does minimum bactericidal concentration mean? The lowest concentration of antibiotic that results in the death of 99.9% of bacterial population. What is the primary mechanism of action of penicillin? Interference with the bacterial cell wall synthesis, binding to the penicillin binding protein, inhibit transpeptidase. So transpeptidase is a protein responsible for cross-linking between the peptide and the bacteria, transpeptidation. Name the natural penicillin. We have penicillin G given IV or IM and penicillin V available oral. Which penicillins are anti-staphylococcal resistance to beta-lactamase? Which penicillins are anti-staphylococcus resistant to the beta-lactamase? We have methicillin or methicillin, nafacillin, oxacillin, dicloxacillin. Which drug consider extended spectrum penicillin? We have ampicillin and amoxicillin. What are anti-pseudomonal penicillin? We have piperacillin and tigarcillin. We have list of medication, not only two, we have more. The most popular anti-pseudomonal penicillin, we have piperacillin and tigarcillin. What is the role of beta-lactamase inhibitor? Why you use beta-lactamase inhibitor? The beta-lactamase inhibitor protect penicillin from being destroyed by bacterial enzyme, and example of beta-lactamase clavulanic acid. Beta-lactamase inhibitor example clavulanic acid. Name a common penicillin beta-lactamase inhibitor combination. We have amoxicillin clavulanic acid. Okay, we have amoxicillin clavulanate and the brand name Augmentin. Then we have piperacillin tazobactam and the brand name Zosyn. Okay, how many generation of cephalosporin are typically recognized? We have 5 generation. Name one first generation. Name a first generation cephalosporin and its primary use. Okay, for example, we have cefalexin, cefazolin. They use for skin infection or surgical prophylaxis. Cefazolin for surgical prophylaxis. Which generation of cephalosporin is ceftriaxone? Belong to the third generation. What is the unique clinical use of ceftriaxone? Ceftriaxone used for treatment of gonorrhea and meningitis. Name fourth generation cephalosporin. We have Cevipime, which is special about fifth generation cephalosporin, ceftaroline. Anything special about fifth generation cephalosporin, ceftaroline? They have activity against MRSA, methicillin resistant Staphylococcus aureus. Okay, this will conclude first part of flashcard of antimicrobial therapy. Thank you and see you next time.